I'm going to introduce our speaker, Michele. She's currently working with local government on housing issues. For 15 years, Michele has worked for a domestic violence and sexual violence center, for the victims of those things. Through this, Michele has seen the intersection of access to healthcare and the needs of domestic violence abuse survivors. Michele Hamilton is a member for the Pennsylvania Religious Coalition for Reproductive Justice, which brings the voices of people of faith to the fight for reproductive justice issues. She's the chapter president of, oh boy, I'm going to mispronounce this, Nitane Center County now? Did I get it right?
Yep.
Okay.
Trust me, that's as close to right as anyone has ever gotten it. It's
okay, good. And she's also a member of, I'm going to mess this one up too. Let me see, Seroptimist International and her local NAACP. And Michele Hamilton, she's also a board member of One Payer States, which is a national organization that fights for single payer guaranteed health care, both on the state level and the federal level. And she brings the issue of healthcare for everyone into all these spaces. True access to comprehensive healthcare is essential to move forward multiple movements, including but not limited to the movements to secure housing, education, ending racism, and ending the patriarchy. So we're really, really happy to have you here, Michele, and the floor is yours.
Okay. So thank you very, very much. First, I want to say that I'm here because of Stefan, and we met through another great organization called Justice for All Network. So I have to give shout out to them. But we quickly became like close over housing and healthcare. So I am greeting you from very cold PA. I live in the center of Pennsylvania, which is called Center County. It's the home of Penn State University. I also want to say I have a very attention-seeking and talkative cat. So if you hear stuff in the background, that's the cat. So as my bio says, I'm in a lot of things, and I am in a lot of things because there are so many, sometimes we're a little siloed and we have so many different movements that concentrate on different things. But healthcare is the number one thing that I try to bring to all the different groups that I'm in. So I always talk about telling your story when I do any kind of discussion about healthcare or any issue. And definitely a lot of you here have probably had to tell your stories and how you got involved in this movement, to politicians, to various nonprofits, as you try to get people engaged in this work. So the very short story is that I am originally from New York City, and I came to Penn State to go to school. It was not a great experience, but I liked where it was. And so I started living and working here. And one of the job that I'm most identified with and that has shaped me and sort of brought me to healthcare for all and the need for universal healthcare is this job with an organization that's called Center Safe, which was formerly the Center County Women's Resource Center, and which is our county's dual center for survivors of domestic and sexual violence. And in the context of working primarily with survivors who were homeless, men, women, and children who were homeless because of domestic violence, I realized that I didn't know as much about homelessness as I thought I knew, even though I'd been working on homelessness issues since I was 15. And I realized I definitely did not know as much about healthcare as I thought I knew. And so I want to talk a little bit about the things that I learned and stuff, and the way that healthcare for all can really uplift survivors of domestic violence. The first starting with all the things that survivors lose and stuff in terms of the healthcare system we have now. So I am not totally sure how your system works in terms of going from county to county or parish to parish, but here in PA, we have 67 counties. And say there is a situation where a survivor flees an abusive relationship, and they go from one county to another. So the nearest county to us is Huntingdon, which is about 40 minutes away. Because of the current medical model that we have, often survivors who are fleeing violence and have to go from one part of the state to another part of the state lose out on medical benefits. So they then have to reapply and stuff certain types of things like mental health and drug and alcohol counseling have long waiting lists. These survivors start on the bottom of these waiting lists, even though they are in real need of the services, because money does not follow the person, money follows the county. And this setup is a setup that is basically to the benefit of HMOs. So, and not obviously to the benefit of survivors. And of course, this affects other people who go from one county to another as well. But so 1 in 4, you know, people who are homeless due to domestic violence on our what's called HMIS lists here. Like 1/3 of the list is of people who are homeless or people fleeing because of domestic or sexual violence. So the other way is also basically obviously the physical trauma that survivors go through that they need medical assistance for, and as importantly, the mental health trauma. And one of the things about our current system, which maybe we don't emphasize as much when we try to talk about the need of healthcare for all, is how mental health is a lot of times deprioritized. I know in this particular county that I'm in, we have a very long waiting list for any kind of blended case management, drug and alcohol counseling. And I'm not saying that to put down the people who do that work, but just to say that when you have a profit driven system that also underpays the people who are doing the work, what you get is people in general and survivors in particular that don't have access to things that they need and stuff. And survivors dealing with the trauma of both being homeless and escaping an abusive relationship, often dealing with physical trauma and psychological trauma, really need these services yesterday. The other thing is, in terms of the physical trauma that survivors face, things that the specialty care that sometimes is needed. So I once worked with a person whose abuser threw her out of a car. And based on that, she had broken the front of her teeth. And it took her 2 years to get to a point where she could get any kind of dental surgery or anything like that. Because specialties, as what's called specialties, as we know, are particularly hard to get and to have access to. And of course, I do have to mention and stuff, access to reproductive needs, including but not limited to birth control and abortion care, if those which are sometimes needed by survivors of domestic and sexual violence as well. And for a variety of reasons, not all of that, for a variety of reasons, are inaccessible and stuff. Another big issue is often a loss of insurance when insurance is connected to the partner that is abusive. So when the person decides to break off the relationship, they're also breaking off the healthcare and insurance. And so in the job that I had until the last 8 months, I was really able to see how, all these medical needs were part of like the lack of access to healthcare because of the current medical model we have was really detrimental to the healing of survivors, both physically and mentally. And sometimes honestly trap them in abusive relationships because in some situations, like I said, the perpetrator was paying for the medicine or paying for the therapy and would use that to sort of control the relationship. The other thing that was also important is the importance of healthcare to housing, which I'm definitely seeing more now that I work at the county. So I will tell you that a lot of the people that I'm seeing now cannot even search for housing because of health reasons, because either of chronic health reasons that are just not being seen or not being taken care of because the insurance isn't the right insurance, because they had to go from one county to another, because the plan wouldn't pay for it, things like that. And so I've worked with several people who are not even physically able to look for a new place, even though they want to. In addition, as we know, you already know this, medical expenses are the number one expense that can take a person from housing insecurity to homelessness. The inability to go to work and get money to pay bills, the inability to like have to choose between your rent and your medicine, or your rent and your physical therapy. And then in rural areas, and I don't know how rural um, Florida is, but in PA, the vast majority of our state is rural. And for people who are living in rural areas, the homelessness situation has actually gotten much worse, and the medical connection is actually much stronger because they don't have access to a lot of different medical places to begin with, because the medical industrial complex does not invest in rural areas. So they don't even, they might be having to go 50 miles just to find a doctor or some kind of specialty person. Um, wait, am I over? I hope I'm not over time and stuff, because I know there's like a certain time and stuff. Nope. Okay. So, um, in addition to that and stuff, we also are seeing a lot of people who are homeless who really need mental health care and drug and alcohol and stuff, counseling and support. And like I said, either the policy doesn't support it, or there are not enough workers to provide the mental health counseling. We see people losing their housing to like go into therapy or to long-term health care, or losing their housing when they go into treatment and having no place to go. We also have here in Center County two prisons and one jail, and no halfway house or anything like that. So we see a lot of returning citizens who have no kind of health care once they get out of jail. I don't know what the situation there is, but here you get substandard health care in the jail and no health care out of the jail. Now, we do have a what we would call a free clinic, but it's only one, and it does pretty much the work of like what real, I'm not even going to get into that. But anyway, we have a small free clinic that does see some people, but nowhere, they do not have the capacity for the amount of need. And basically, when I am talking about single payer and the need for single payer, I always try to bring these things up because they're, in my opinion, not discussed enough. And also because we need to see that a lot of, without healthcare, you can't have the access you need to do the things you need to do, including to keep your housing, including to be in relationships you want to be in and not be in relationships you don't want to be in. So access to quality healthcare is sort of essential to anything that you're doing in life and stuff. And as if we can bring together all these different, sometimes siloed groups, I think we can make a bigger impact. And I think that we can do a better job of showing the general public why the need. Because if we're only talking about very general situations and not talking about specific things like domestic violence and housing, that it can be very easy for people who are against what we are for to come up with various ridiculous arguments and stuff about why it's not needed. But it's been my experience that when people see how the lack of affordable health care, the lack of accessible health care, and the current system we have is negatively affecting different groups of people in a very specific way, they're more likely, from what I've seen, to sort of see why a Medicare for all system is necessary. So I'm not trying to say that, we should never talk in generalities, but I also think that one of the things that we can do as we grow as a movement is to sort of push forward the idea that healthcare is essential in every aspect of life. And for me, talking about these issues is hopefully doing something that will help future survivors by bringing Medicare for all to fruition, and that will help with housing also by bringing Medicare for all to fruition. So I'm going to end now because I feel there's supposed to be a Q&A, and I know there's another speaker, and I want to respect that. So, and healthcare is a human right. It so is, and stuff, which we're going to talk about when we get to one payer states. Anyway, so if people have questions, general or specific, I don't know how you guys want to do this. If they just unmute themselves or type it in the chat, or
We've got one from Stefan, and then I think in the interest of times, we do have another speaker. We'll if other people have questions, if you want to put them in the chat, and we can collect them, and could we get them to you, Michelle, after, and then we can.
Oh yeah, I can do that. That's cool.
Awesome. So Stefan had the question for you, Michelle. With you being a board member of one payer states, would you encourage us in Florida to also advocate for a state level single payer program, basically a Medicare for all in Florida, such as the Healthy Florida Act?
I would absolutely encourage that. So One Payer States, for those of you who don't know, is a nationwide group of people from all over the country. We're activists from all different parts of the country. We all bring different talents and stuff. But our goal is basically the creation of many, many one payer states. And this is rooted in the idea that if healthcare for all as a state issue, not that we reject national, that's not what we're not rejecting the federal, but if there is a demand for healthcare for all in the various states, it will become so huge that federally they will not be able to ignore it. Also, we believe that states, know the various needs of the people in the state and have a very unique voice and stuff. So I would totally, totally advocate that. There is actually something called the State-Based Universal Healthcare Act that might be coming up again for a vote. Oh yeah, I know. Trust me. I totally know about Florida. Pennsylvania can't protect it either. And stuff. But and if you want to talk about that and stuff, I'm gonna put my. If you all guys want to talk about anything, I'm gonna put my email in the chat, and we could chat about that. Trust me. But the State-Based Universal Healthcare Act is basically something that creates a waiver to allow states to develop their own plans to provide access to healthcare for all residents via access to federal funding streams and regulations that are flexible enough to support affordable universal healthcare plans. So I would very much encourage it. I honestly think that we need I'm part of Healthcare for All PA. So in addition to the national group, I'm also part of a state group. And I can tell you that it is very, very helpful to have that and stuff. It's sometimes stressful because I feel like our politicians are similar, but it has been, we've had much more of a voice at the table and ability from a statewide perspective to educate people about this that never really thought about it. I think sometimes we don't realize what a revolution we are trying to put together. This is really pushing back on like several industrial complexes and stuff. And so if you as Florida can create something that can do that, that would be amazing. And I know that Pennsylvania would want to work with you and that we would want to support each other. So it's a lot of work, but I think it would be really worth it. So any other questions?
Something. Thank you so much, Michelle. And, thank you for coming to speak to us and sharing your expertise and, letting us know about what it's like, on the ground there in Pennsylvania. I do think there are a lot of similarities between our two areas with the very conservative politicians and the rural areas and all of that. And if you don't mind sharing your email, we would definitely, and people might have questions.
I am typing it as we speak, so feel free. And then just put, Medicare for All Florida in the tagline, so I know that that's how I know you all. And just ask your questions or give your comments and feedback, and I appreciate it. I'm sending it now.